Good morning, everyone. Hope you all guys are doing fine. So today's topic is continuation of acute respiratory infections. So yesterday we had discussed regarding acute respiratory tract infection and its prevalence and problem statement, and the agent factors, host factors, and risk factors. And we have discussed regarding the clinical assessment and physical examination. So today I am going to discuss the classification of illness based on the signs and symptoms. The classification of illness based on the signs and symptoms. Coming to the classification of illness, how you can classify the child means we are classifying the child age group, that is from 2 months up to the 5 years of age. This is for the age group 2 months to 5 years of age. So how we can classify means we are classifying mainly into 4 types. The first one is very severe disease, second one is severe pneumonia, and third one is pneumonia which is not severe, and fourth one is no pneumonia. The child may have cough or cold. So based on the following guidelines, what we are doing means we are classifying the illness of the child based on the following guidelines, and based on the signs and symptoms which they are exhibiting, we are classifying the child into 4 types: very severe disease, severe pneumonia, and no pneumonia. So the first one is very severe disease. So the child may exhibit these type of symptoms. The child may not able to drink, the child may have convulsions, abnormally sleepy or difficulty to wake, stridor in calm child, and severe malnutrition. You can say the child is having very severe disease when you are having this type of symptoms. So when the child will be not able to drink means the child who is not able to drink might have this following type of diseases. He may have severe pneumonia or bronchiolitis, septicemia, throat abscess, meningitis, or cerebral malaria. So whenever a child is having these type of diseases, the child may be not able to drink. So this is the sign not able to drink is one of the key sign for classifying the child into a very severe disease. So when the child will be not able to drink means when he has this following diseases. So what are the diseases which are making the child not able to drink means they are severe pneumonia, bronchiolitis, septicemia, throat abscess, meningitis, and cerebral malaria. And the second sign in the classification of very severe disease is convulsions and abnormally sleepy or difficult to wake. When these signs will persist means when the child has severe pneumonia which is resulting in hypoxia, and when the child is suffering with sepsis, when the child has any cerebral malaria or meningitis. And this meningitis, it is one of the complication of pneumonia. Or sometimes it can occur on its own. So whenever these type of signs are present in a child, the possible sign may be convulsions, abnormally sleepy, or difficult to wake. So the sign convulsions and abnormally sleepy or difficult to wake will be exhibited when the child has these type of signs. And the third one is stridor in calm child. What is this stridor? If you have seen the yesterday's class, you know what is stridor. This is occurring due to the obstruction of airway, which is leading the passage into the lungs. So whenever there is obstruction, you will hear the sound stridor, nothing but a harsh noise. So this is one of the sign for classifying the child into severe disease, very severe disease. And the next one is severe malnutrition. So when the child is having severe malnutrition, then you can classify that the child is having very severe disease. A severely malnourished child is at high risk of developing and dying from pneumonia. In addition, the child may not show typical signs of illness. So whenever you come across a child who is having these following symptoms means not able to drink, convulsions and abnormally sleepy or difficult to wake, and stridor in calm child, and severe malnutrition. If the child is exhibiting these types of symptoms, you can classify the illness of the child into very severe disease. And what you have to do, a child who is classified as having severe disease or is very ill and should be referred urgently to the hospital. So whenever you come across a child like this, what you have to do, you have to refer the child urgently to the hospital. So how you can manage? So what are the signs? As I discussed earlier, the signs include not able to drink, convulsions, abnormally sleepy or difficult to wake, stridor in calm child, and severe malnutrition. You have to classify the child as very severe disease. What is the treatment? Refer urgently to hospital. Give the first dose of an antibiotic. Regarding this treatment, I will discuss in the earlier coming slides. Next one is you have to treat the fever if it is present, and you have to treat the wheezing if you have to treat the wheezing if it is present. If cerebral malaria is possible, give an anti-malarial. So if you find out that the child is having cerebral malarial symptoms, you have to start the anti-malarial. This is the management of very severe disease. Next one is severe pneumonia. How you can classify the child is having severe pneumonia means, mainly the most important sign to consider when the child when deciding the child has pneumonia, or you have to check child respiratory rate. So how you can conclude that the child is having severe pneumonia? What are the signs and symptoms that you have to take care whenever you are deciding, you are confirming that the child has pneumonia? So what are the things that you have to look for are child's respiratory rate, and whether the chest indrawing is there or not. You have to check whether there is stress in chest indrawing. As I shown in the earlier slide, you know what is chest indrawing. A child with chest indrawing may not have fast breathing. So you have to look for these type of things also. And if the child becomes exhausted, and if the effort needed to expand the lungs is too great, so whenever he is taking too much effort to expand his lungs and the breathing slows down, in such cases chest indrawing may be the only sign that the child is having severe pneumonia. In these cases only the chest indrawing is the only sign that you are classifying the child is having severe pneumonia. So what is this point saying? You have to check for child's respiratory rate. You have to check whether there is chest indrawing is there or not. So the child who is having chest indrawing, it is not meant that he has to breathe very fastly. In some cases the child may breathe very fastly. In some cases the child may not breathe, and sometimes the child becomes exhausted because of the vigorous breathing. The energy levels of the child will be lowered down, so that he will keep lot of effort in expanding his lungs, so automatically the breathing pattern will slow down. So it doesn't mean that if a child is having chest indrawing, he has to breathe, it doesn't mean that he has to breathe very fastly. So if the child becomes exhausted, if he is keeping too much effort in taking breaths, then automatically the breath will slow down. So what you have to look for carefully is, you have to look for the chest indrawing near the chest walls. So this is the only sign to classify that the child is having severe pneumonia. So the child, the following are the signs and symptoms that the child has this severe pneumonia. So nasal flaring. So whenever they are having nasal flaring and grunting, and next one is grunting and cyanosis. So nasal flaring, when the nose widens as the child breathes in. It occurs when the nose widens as the child breathes in. And when this grunting sound occurs, means the short sounds made with the voice when the child has difficulty in breathing. So whenever a child is having difficulty while he is breathing, so he will make the sounds, small type of sounds, which are known as grunting. And what is this cyanosis? This cyanosis is nothing but bluish or purplish coloration of the skin, which is caused due to hypoxia. What is this hypoxia? Whenever a child is unable to breathe adequately, and there is decreased breathing, there is decreased respiratory rate, he will be resulting in this condition called hypoxia, which is nothing but the skin may be either purplish or bluish in color, and some children with chest indrawing has also this wheezing. So the children who are having this chest indrawing, they may also exhibit the other sign which is known as wheezing. Wheezing means what? It is abnormal lung sounds. It is one of the abnormal lung sounds. So this is severe pneumonia, and this is the classification. Coming to the management of severe pneumonia, how you can manage a child of severe pneumonia who is aged from 2 months to 5 years of age. What are the signs you have to check for? You have to check for the chest indrawing. You have to check for the chest indrawing, whether the child is having nasal flaring or not, whether the child is having the grunting sounds or not, whether the child is in cyanosis state or not. So based on whether the child is having any kind of wheezing. So based on these symptoms, if you come across a child when you are examining the child, and if you find these types of signs, you have to classify the child as a severe pneumonia patient, and what is the treatment that you have to give is you have to refer the case urgently to the hospital. And same as very severe disease, you have to give the first dose of antibiotic, you have to treat the fever, you have to treat the wheezing if it is present. So if the referral is not feasible, treat with an antibiotic and follow closely. So if you are unable to refer the case, immediately you have to start the correct antibiotic, which I am going to discuss in the coming slide, and you have to follow the patient very closely. This is how you can classify the child who is having severe pneumonia. So far we have discussed regarding very severe pneumonia and severe pneumonia, and the third one is pneumonia which is not severe. So what are the signs and symptoms that will be exhibited by the child who is having pneumonia are: the child may have fast breathing, and there will be no chest indrawing. If the child is having chest indrawing, you can consider the child as he may have very severe disease, and he may have severe disease, very severe disease and severe disease. So based on that, you have to classify the child. So coming to this pneumonia which is not severe, the child will have fast breathing, but there is no chest indrawing. When there is no chest indrawing associated with fast breathing, you have to classify the child as pneumonia which is not severe. If there is fast breathing associated with chest indrawing, you have to classify, and other symptoms like nasal flaring, grunting and cyanosis, you have to classify the child as severe pneumonia. Coming to the very severe pneumonia, if the child is exhibiting fast breathing with chest indrawing and severe malnutrition and stridor and convulsions, you have to classify the child as very severe disease. So coming to the management of pneumonia which is not severe, so no chest indrawing is present, and fast breathing, how you can determine whether the child is having fast breathing or not means 50 breaths per minute in a child of 2 months to 12 months of age, and from 12 months to 5 years the child will have 40 breaths per minute. So this is how you can classify the fast breathing. So you have to classify as a pneumonia. And what is the treatment? You have to advise the mother to give home care, because it is not so much severe. And second one is you have to start the antibiotic, and if there is any kind of fever, you have to treat the fever, and if there is any kind of wheeze, you have to treat the wheezing, and you have to advise the mother to return to the hospital with the child after 2 days for the reassessment. So whether the child situation is worsening or whether the child situation is improving. So these are the treatment modalities. So last one is pneumonia. When you can classify that the child has no pneumonia. So these children will exhibit some signs and symptoms, that is simply like cough or cold. They are classified as having no pneumonia. They do not need any kind of antibiotic. Normally if the child has a cold, he will get better within 1 to 2 weeks. Or if the child has cough, if you are starting proper treatment, the child will resolve from the cough. And if the cough is persisting beyond the 30 days, if the cough is persisting beyond 30 days in spite of the treatment, you have to consider, you have to suspect for tuberculosis and you have to go for the treatment. And you and the patient with asthma, whooping cough or some other problem, these childs also may not have this pneumonia, may not have this pneumonia. So what you have to do, you have to check for the signs. You have to check, if it is simple cough, it will go within 1 to 2 weeks. There is no need of starting any kind of antibiotics. If any cough is there, you have to give them the decongestants, and we have to give you have to treat the patient properly. In spite of treatment, if the cough is persisting for more time, like more than 30 days or any kind of chronic cough situations, you have to suspect the patient for tuberculosis. And if based on the chronic cough conditions, you have to refer the child for further investigation. This is regarding no pneumonia. And what is the treatment means? If coughing is more than 30 days, refer for assessment. Assess and treat ear problem or sore throat if present, and assess the treat and other problems. Advise the mother to give home care. If there is fever, you have to treat the fever. If there is wheezing, you have to treat the wheezing. This is regarding classification of illness in the age group of 2 months to 5 years of age. This is regarding the classification of illness from 2 months to 5 years of age. The second one that we are going to discuss now is classifying the illness of the young infant, that is below 2 months of age. So what is the cutoff point for the respiratory rate? Is the cutoff points for respiratory means the cutoff point for breath rates per minute is 60 breaths per minute. So any kind of pneumonia which is present in the infant is to be considered very severe. So if the child is having pneumonia, it is considered to has similar severe problem, and you have to refer the child immediately to the hospital. So what are the signs and symptoms of very severe disease? Are the signs and symptoms include convulsions and abnormally sleepy or difficult to wake, and second one is stridor when the child is calm, and third one is stopped feeding well, and the fourth one is wheezing, and you have to check for the fever and low body temperature. Then you have to classify the patient into a very severe disease. So first one, convulsions and abnormally sleepy or difficulty to work. When you will have these type of symptoms means, so the child may have this type of symptoms from hypoxia, which is occurring due to pneumonia, and in case of sepsis and meningitis, you can see the above sign. And if the patient has malarial infection, which it is unusual in children, but if the patient has this infection, you can see the signs of convulsions and abnormal sleepy or difficulty to wake. Next sign is stridor when calm. The next sign is stridor when calm. So if you come across a child who is having stridor when he is in calm state, it means you have to classify the child to have a very severe disease. And what are all the causing factors for stridor means, when the child has diphtheриal infections or any bacterial tracheitis or measles or epiglottitis. So an young infant who has stridor in calm state should be classified as having very severe disease. And when the child will stop feeding well, when the child is stopping for feeding well, so what the child will do in this stage means, so if the child will not take the total amount of milk, usually if he is drinking, for example, usually he is drinking like 500 ml of milk per day. So what he will take, he might take only 100 ml or 150 ml. So he will drop to the half level. This occurs due to any kind of serious infection. So whenever the child is stopping to feed well, you have to consider the patient as having very severe disease. And the other sign is wheezing. So whenever the child is exhibiting wheezing, whenever you are hearing the wheezing sounds, which is very uncommon in children, and if it is associated with hypoxia, you have to consider the child is having the very severe disease. And the fever, which may be either it can be hypothermia or it can be hyperthermia. So based on that you can classify the child is having very severe disease. So classification and management of illness in young infants. How you can classify where the child is having very severe disease? Who is the age group of 2 months of age? So if the child is stopping to feed well, if there are convulsions, and if there are abnormally sleepy or difficulty to wake, if there is stridor in a calm child, and if there is wheezing, and if there is fever and low body temperature in a child, then you can classify that the child is having very severe disease. And the treatment includes, you have to refer the child immediately to the hospital. You have to keep the infant warm in case of hypothermia, and you have to give the first dose of antibiotics. So this is the management and illness in young children. And the second, how you can classify the child is having severe pneumonia. We can classify, so same like adult, same like the age group 2 months to 5 years age, there are 4 types: very severe pneumonia, very severe disease, severe pneumonia, pneumonia which is not severe, and no pneumonia. And in the children also there are 3 types: very severe disease, severe pneumonia, and no pneumonia or cough or cold. How you can classify that the child has severe pneumonia means when there is chest indrawing and the fast breathing more than 60 breaths per minute, you can classify the child is having severe pneumonia. And what you have to do, you have to refer the child to the hospital, you have to keep the infant warm, you have to give the first dose of antibiotic. So how you can classify that the child doesn't have pneumonia? So when there is no chest indrawing and when there is no fast breathing, simply if the patient is exhibiting cough and cold, you have to classify the patient as no pneumonia. You have to advise the mother to give home care. What she has to do, she has to keep the young infant warm, and she has to breastfeed the child very frequently. She has to clear the nose if it is interfering with the feeding. So again, written quickly, if the breathing becomes difficult, breathing becomes fast, feeding becomes a problem, the young infant becomes sicker. So what she has to do, if the child is showing the symptoms like breathing difficult and increased breathing pattern, what she has to do, she has to refer the child immediately to the hospital. So this is the classification of infants. So coming to the treatment part. The treatment part for the children who are having illness, the age group is 2 months to 5 years of age. So mainly the cotrimoxazole is the drug of choice for the treatment of pneumonia. Cotrimoxazole is the drug of choice for the pneumonia. So cotrimoxazole, it is not given in premature babies, and in case of neonatal jaundice it is contraindicated. So what is this cotrimoxazole means? It is a mixture of 2 drugs. Sulfamethoxazole and trimethoprim. So it is a combination of 2 drugs, sulfamethoxazole and trimethoprim. So how it is given in children means, so it is, if the child is less than 2 months of age and the weight is about 3 to 5 kg, you have to give 1 tablet twice a day. 1 tablet twice a day. And if you are giving it in the syrup form, if you are giving it in the syrup form, 2.5 ml per 2.5 ml twice a day you have to give to the child. I'll say it very clearly. So treatment of pneumonia on daily basis when you are using this cotrimoxazole. So based on the age, the dose will vary. So based on the age and weight, if the child is less than 2 months of age and if he is weighing for 3 to 5 kg, you have to give 1 tablet twice a day. You have to give 1 tablet twice a day, and you have to give means you have to take 1 tablet, you have to give 1 half in the morning and you have to give other half in the evening. If you are giving it in the syrup form, you have to give 2.5 ml twice a day. You have to give half spoon, that is 2.5 ml twice a day. That means morning 2.5 ml and evening 2.5 ml. If the child is about the age of 2 to 12 months and if his weight is about 6 to 9 kgs, you have to give 2 tablets twice a day, morning 1 tablet and evening 1 tablet, morning 1 tablet and evening 1 tablet. And how you have to give the syrup means you have to give 5 ml of syrup in the morning, you have to give 5 ml of syrup in the evening. If the child is aging for 1 to 5 years and if the weight is about 10 to 19 kgs, if the weight is about 10 to 19 kgs, you have to give 3 tablets twice a day. You have to give 3 tablets twice a day. Means 1.5 tablet on the morning and 1.5 tablet in the evening, and 1.5 spoon, that means 7.5 ml of syrup on the morning session and 7.5 ml of syrup in the evening session. So this is the treatment with the cotrimoxazole when the child is infected with the pneumonia. So in severe pneumonia, what is the treatment means? Children with severe pneumonia should be treated as inpatients. Means the children has to be admitted in the hospital, and intramuscular injections are given, IM injections are given. Mainly what type of injections are given? Benzyl penicillin, ampicillin or chloramphenicol. So benzyl penicillin is given only after the test dose. If the condition of the child must be monitored every day. So whenever you are starting the antibiotic for the child, you have to monitor the condition of the child, and within 48 hours you have to review. You review the condition immediately within 48 hours after starting an successful antibiotic. Coming to the treatment of severe pneumonia in the age group of 2 to 5 years. So first 48 hours you have to give benzyl penicillin or ampicillin or chloramphenicol. So based on the availability drug, you have to choose it. So what is the dose? If you are giving benzyl penicillin, you have to give 50,000 international units per kg body weight. 50,000 international units. If you are giving ampicillin, you have to give 50 mg per kg body weight. If you are giving chloramphenicol, you have to give 25 mg per kg body weight. So what is the interval means? 6th hourly you have to give the 3 tablets. If it is benzyl penicillin, you have to give 6th hourly in a day. 6th hourly means QID, means 4 times a day. And if it is ampicillin, you have to give 6th hourly. If it is chloramphenicol also, you have to give 6th hourly. And what is the route? The route is mainly intramuscular route. And the next one is if the condition improves in next 3 days. So if the condition is improving, after 48 hours, means after starting the antibiotic within 2 days, if the condition of the child is improving, you have to go for procaine penicillin. So the dose will be like 50,000 international units per kg body weight. You have to give once a day. It is given orally, and if it is not possible, you can change the patient from injection form to oral form. So there you can give ampicillin 50 mg per kg body weight 6th hourly, and chloramphenicol 6th hourly. The dose will be 25 mg per kg body weight. So from injections to we are making the child into the oral form in case of treatment of severe pneumonia. So if there is no improvement, so if there is improvement, you are changing the patient from injection form to oral form. You are changing some kind of antibiotics if there is improvement. But in case if there is no improvement, then you have to change the antibiotic within next 48 hours. If ampicillin is used, you have to change it to chloramphenicol. If chloramphenicol used, you have to change this to cloxacillin 25 mg per kg body weight, and every 6th hourly along with the cloxacillin, you have to give the patient gentamicin, which is 2.5 mg per kg body weight for every 8 hours. That means BD dose of gentamicin and QID dose of cloxacillin. BD dose of gentamicin and QID dose of cloxacillin and BD dose of gentamicin. So if the condition is improving, you have to make the patient to the oral form, and you have to give the symptomatic treatment. If there is fever and wheezing, whenever it is required, you have to monitor fluid intake and fluid output, and you have to advise the mother and you have to explain the mother home management after the discharge of the child. This is the treatment of severe pneumonia. So in brief again I would like to discuss this. So what is the first drug of choice? Within 48 hours you have to start either benzyl penicillin or ampicillin or chloramphenicol. So the doses will be like, the doses are described in the table, you can check here, and you have to give accordingly QID dose you are giving. So if the patient is improving condition after starting the antibiotic after 48 hours, if there is improvement in the condition of the patient, what you have to do, you have to change the treatment pattern. So if he is taking in injection form, you have to make it into the oral form. So suppose if you start benzyl penicillin, you have to change the benzyl penicillin into procaine penicillin. If you have started ampicillin IM injection, you have to change ampicillin IM into ampicillin oral. If you have started chloramphenicol IM injection, you have to change the chloramphenicol to oral. So if it is improving, you have to do that. If it is not improving, then what you have to do, if you have started the ampicillin, what you have to do, you have to change this to the chloramphenicol. So along with this chloramphenicol, so how many doses you have to give? You have to give 6 hourly, means QID dose you have to give. Along with this chloramphenicol, you have to give gentamicin 2.5 mg per kg body weight every 8 hourly. That means for every 8 hours, that means TID dose you have to give. TID dose means thrice a day you have to administer, and 4 times a day you have to give chloramphenicol. And the other one is, if the condition is improving, so after changing the treatment, if the condition is improving, you have to provide the symptomatic treatment. You have to monitor fluid intake and fluid output. Then you have to go for discharge and advise the mother home care. So if the child is having very severe disease, so the child may need some serious hospitalization. So he may require oxygen therapy, he may require intensive monitoring, he may require supportive therapy, and in addition you have to treat the pneumonia also. So in such cases, only chloramphenicol IM is the drug of choice. You have to treat the case for 48 hours. With the chloramphenicol. If the condition is improving, what you have to do? If the condition is improving, you have to switch the chloramphenicol injection to oral form, and you have to continue the treatment for next 10 days. If the condition is worsening after 48 hours and if it is not improving, you have to go for cloxacillin and you have to go for gentamicin. So this is regarding treatment of severe pneumonia and very severe pneumonia. So next one is, if the child is having pneumonia. So as I said, for infants, how many classifications we have done? For infants we have done only 3 classifications. What are the 3 classifications we have done? The child may have pneumonia, the child may have severe pneumonia, and the child may do not have any kind of pneumonia. So the first one is pneumonia in young infants and who are under 2 months of age. The treatment in this condition is basically the same. So however the treatment is discussed earlier, the same treatment will be given here also. The child will be hospitalized, and what we will give is we will give benzyl penicillin or ampicillin or gentamicin. So you can see here what are the treatment pattern we are giving. We are giving injection benzyl penicillin, which is about 50,000 units per kg body weight. We are giving 12 hourly for the age of children who are less than 7 days of age. If the age of the child is about 7 days to 2 months of age, we are giving 6 hourly. If you have started ampicillin 50 mg per kg body weight, if the child age is less than 7 days, we are giving BD dose. If the child age is about 7 to 12 days, we are giving TID dose. If it is gentamicin, we are giving 25 mg per kg body weight 12th hourly in the age group of less than 7 days. If the age of the child is more than 7 days to 2 months, we are giving TID dose. So thank you for watching. If you have any query regarding this treatment part, you can discuss with me. I'll say you clearly when you people will come back to the class. Okay, there is no need to get confused here. It is very simple. Mainly the drugs which are used in the treatment are chloramphenicol, gentamicin, benzyl penicillin, ampicillin. Only these are the drugs which are used in the children who are having ARI. So based on the symptomatic, we are treating the cases. So based on the condition of the patient and based on the situation, whenever he is improving, the treatment pattern is changing. If the condition is worsening, again the treatment pattern is changing. So like this we will treat the patient. So if you have any doubts, you can contact me in the WhatsApp. I will clarify you clearly. Thank you for watching.